So going back about 18 months, we were in a position where we felt we could begin deploying. We had ambient listening capabilities, and we were working with a number of different teams, Microsoft, Samsung. We're working with United Healthcare, Optum, and Cigna, looking at deployment in multiple hospitals across the US. But we're also deploying in Japan. We're deploying in Canada. We're deploying I mentioned Holland earlier, also in the United Kingdom and Ireland. So we're beginning to see traction in all of those places. South America, for instance, is growing tremendously. I was in Ibiza at the Alzheimer's Association meeting recently, about a month ago, where we presented with a team from Guatemala. So 4 years ago, if anyone said, "Oh, you'll be working with the team in Guatemala," no connection at all with them. Today, we do. We're testing. We're rolling out in 6 different nations in South America in Alzheimer's disease. We're rolling out with a number of other groups there. So South America, U.S., Canada, Japan, and Saudi Arabia are probably the Arab countries are probably the ones adopting fastest. And then we're working in Holland and we're working in other places. We'll roll out in German later this year, later, early next year. We're adding German, for instance. And so once we validate in a particular language, we're deployed in these places already, but we're then commercially available to do something. I mean, it takes some time to validate in each of the languages in order to deploy. English languages, Spanish, Dutch. We're adding Mandarin. Mandarin will be done by the end of first quarter. And for U.S. Mandarin or Chinese populations, Mandarin speaking people, for about 4 different diseases. So that's
Mm,
kind of the rollout. We have demoed our product and are rolling out to more than 1,000 hospital clients in the U.S. right now in our partnership with Microsoft, for instance.
can or could or will patients be able to get and use this technology just as consumers anytime?
So um, we we are going to introduce a consumer-based product this year. We're
In
pilot
2026 or in
Yes,
2025? 2026.
2026. We're right now. Um, the everything that we do is based on the clinical models, which is different than many other companies. Many companies have developed using Facebook or Craigslist as data gathering sources, which we just would never do. You can't control for that. I don't believe it's ethical to do it that way. You really need a controlled clinical environment to properly build the models. That's just our opinion. So we're going to pursue that line. But we're rolling out a wellness product first to industry, where industry would use it with their employees. We do have an app. We use our app internationally across multiple countries, across multiple languages, but we don't deploy or sell an app.
Mhm.
It's not something we do. There are a number of healthcare institutions using our app configured for them, specifically white labeled, if you will, to them. The reason we didn't was this focus on an intention that you needed to develop over in the clinical space in order to get the efficacy and get the requirements and get the peer review and papering, academic papers. So that's kind of how we did the work. It's a little slower. It's a little more arduous. It takes a little more time, but I personally think it's well worth it. So now we're going in 2026, we'll be rolling out to a wellness version of this. And so that we will see advertising for it in first quarter, a launch of it in first quarter.